Information technology, information security, privacy rule. The privacy rule requires that nurses protect all written and verbal communication about patients. Components of the privacy rule include the following. Only healthcare team members directly responsible for a patient's care can access that patient's record. Nurses cannot share information with other patients or staff not caring for the patient. Patients have a right to read and obtain a copy of their medical record. Nurses cannot photocopy any part of a medical record except for authorized exchange of documents between facilities and providers. Staff must keep medical records in a secure area to prevent inappropriate access to the information. They cannot use public display boards to list patient names and diagnosis. Electronic records and password protected. The public cannot view them. Staff must use only their own passwords to access information. Nurses must not disclose patients' info to unauthorized individuals or family members who request it in person or by telephone or email. Many hospitals use a code system to identify those individuals who can receive information about a patient. Nurses should ask any individual can give the code. Communication about a patient should only take place in a private setting where unauthorized individuals cannot overhear it. To adhere to HIPAA regulations, each facility has specific policies and procedures to monitor staff adherence, technical protocols, computer privacy, and data safety. Professional responsibilities, advocacy. Advocacy refers to nurses' role in supporting patients by ensuring that they are properly informed, that their rights are respected, and that they are receiving the proper level of care. Advocacy is one of the most important roles of the nurse, especially when patients are unable to speak or act for themselves. As an advocate, the nurse ensures that the patient has the information they need to make decisions about health care. Nurses must act as advocates even when they disagree with patients' decisions. The complex healthcare system puts patients in a vulnerable position. Nurses are a patient's voice when the system is not acting in their best interest. The nursing profession also has a responsibility to support and advocate for legislation that promotes public policies that protect patients as consumers and create a safe environment for their care. Nursing role in advocacy. As advocates, nurses must ensure that patients are informed of their rights and have adequate information on which to base healthcare decisions. Nurses must be careful to assist patients with making healthcare decisions and not direct or control their decisions. Nurses must mediate on the patient's behalf when the actions of others are not in the patient's best interest or changes need to be made in the plan of care. Situations in which nurses might need to advocate for patients or assist them to advocate for themselves include end of life decisions, access to health care, protection of patient privacy, informed consent, substandard practice. Nurses are accountable for their actions even if they are carrying out a provider's prescription. It is the nurse's responsibility to question a prescription if it could harm a patient. Incorrect medication dosage, potential adverse interaction with another prescribed medication, contraindication due to an allergy or medical history. Sensory perception, nursing actions for patients who have hearing loss. Sit and face the patients, avoid covering your mouth while speaking. Encourage the use of hearing devices. Speak slowly and clearly. Try lowering vocal pitch before increasing volume. Use brief sentences with simple words. Write down what patients do not understand. Minimize background noise. Ask for a sign language interpreter if necessary. Do not shout. Cognitive and sensory impairments. Hearing impairments. Nursing care. Check children for hearing impairment. Promote speech development. Lip reading and use of cued speech. Hand gestures with verbal communication. Encourage socialization and use of aids to promote independence. Flashing light when doorbell or phone rings. Telecommunication devices. Closed captioning on the television. Assist with making a referral for child and family to community support groups. Use sign language or an interpreter if appropriate when working with a child who has hearing loss. Always talk to the child, not to the interpreter. Monitor gait or balance for instability. Identify safety hazards and adjust environment as needed. Assist with the use of hearing aids. Store batteries in safe place. If whistling sound present, turn down the volume or readjust the hearing aid in the ear. Reinforce with families on methods to prevent further damage to hearing. Therapeutic communication, effective skills and techniques. Giving information. This provides factual details that the patient might need for decision making. Hematologic disorders, sickle cell anemia, nursing care. Promote rest to decrease oxygen consumption. Administer oxygen as prescribed. If hypoxia is present, provide intense hydration therapy while maintaining fluid and electrolyte balance. Monitor intake and output. Give oral fluids. Ensure administration of IV fluids with electrolyte replacement. Caution with potassium replacement. Ensure administration of blood products, usually packed RBCs, and exchange transfusions per facility protocol. Monitor for manifestations of hypervolemia and transfusion reaction. Treat and prevent infection. Administer antibiotics. Perform frequent hand hygiene. Give oral prophylactic penicillin. Administer pneumococcal conjugate vaccine, meningococcal vaccine, and Haemophilus influenzae type B vaccine. Monitor and report lab results. Parkinson's disease medications can take several weeks of use before improvement of manifestations is seen. While the patient is taking a combination of medications, maintenance of therapeutic medication levels is necessary for adequate control. Cardiac glycosides in heart failure. Cardiac glycosides digoxin. Nursing administration. Check pulse rate and rhythm before administration of digoxin and record. Notify the provider if heart rate is less than 60 beats per minute in an adult, less than 70 beats per minute in children, and less than 90 beats per minute in infants. Administer digoxin at the same time daily. Evaluate manifestations in the patient's digoxin level when toxicity is suspected. Avoid taking OTC medications to prevent adverse effects and medication interactions. Reinforce with patients to observe for indications of digoxin toxicity, fatigue, weakness, vision changes, gastrointestinal effects, and to notify the provider if they occur. Managing patient care. Assigning, delegating, and supervising. Assigning. Additional factors. When a nurse receives an unsafe assignment, they should task the following. They should take the following actions. Bring the unsafe assignment to the attention of the scheduling or charge nurse and negotiate a new assignment if no resolution is arrived at. Take the concern up the chain of command. If a satisfactory resolution is still not arrived at, the nurse should file a written protest to the assignment. An assignment despite objection, ADO, or document of practice situations, DOPS, with the appropriate administrator. Failure to accept the assignment without following the proper channels can be considered patient abandonment. Delegatee factors. Considerations for selection of an appropriate delegatee include the following: education, training, and experience, knowledge and skill to perform the task, level of critical thinking required to complete the task, ability to communicate with others as it pertains to the task, demonstrated competence, the delegatee's culture, agency policies and procedures, and licensing legislation, state nurses practice acts. Admission, transfers, and discharge. Transfer and discharge process. Transfer documentation. Medical diagnosis and care providers. Demographic information. Overview of health status, plan of care, recent progress. Alterations that can precipitate an immediate concern. Notification of assessments of care, essential within the next few hours. Most recent vital sign and medications, including PRN. Allergies, diet, and activity orders, specific equipment or adapted devices, oxygen suction wheelchair, advanced directives and emergency call status, family involvement in care and health care proxy, if applicable. Cultural, ethnic, and religious influences. Religion and nutrition. Variations based on religion. Eating on holy days. Sub-religions observe feasts on specific days. Eastern Orthodox Christian or Judaism. During Passover, Judaism calls for consumption of unleavened bread only. Fasting for religious holidays. Islam calls for fasting during Ramadan. Roman Catholicism calls for refraining from meat consumption on Ash Wednesday and Fridays during Lent, and to avoid food or beverage intake for 1 hour before communion. Seventh-day Adventism recommends a 5 to 6 hour interval between meals. Judaism calls for a 24-hour fast during Yom Kippur. Restricted food-specific substances, alcohol, Islam, Hindu, Mormon, Seventh-day Adventism. Pork, Seventh-day Adventism, Mormonism. Other, patients who follow Orthodox Judaism might not eat meat and dairy. Patients who follow Judaism might consume only fish that have scales and fins. Consuming animal products, vegetarian diet, Seventh-day Adventism, Hinduism, Buddhism. Orthodox Judaism and Islam call for consumption of kosher animals. Both have regulations for how animals are slaughtered, particular so that no blood is consumed. Managing patient care, performance appraisal, peer review, and disciplinary action. Disciplinary action. Deficiencies identified during a performance appraisal or the course of employment should be presented in writing, and corrective action should be based on institutional policy regarding disciplinary actions and or termination of employment. Evidence regarding the deficiency must support such a claim. Some offenses, mistreatment of a patient or use of alcohol or other substances while working, warrant immediate dismissal. Lesser infractions should follow a stepwise manner, giving warrant immediate dismissal. Lesser infractions should follow a stepwise manner, giving the staff member the opportunity to correct unacceptable behavior. Staff members who witness an inappropriate action by a coworker should report the infraction by the chain of command at the time of the infraction. This might be the charge nurse. The unit manager should also be notified, and written documentation by the manager is placed in the staff member's permanent file. Maintaining a safe environment. Safe use of equipment refers to the appropriate operation of a healthcare related equipment by trained staff. Equipment related injuries can occur as a result of malfunction, disrepair, or mishandling of mechanical equipment. Nurses' responsibility related to equipment safety. Learning how to use and maintaining competency in the use of equipment. Checking that equipment is accurately set and functioning properly. Oxygen nasogastric suction. At the beginning and during each shift. Ensuring that electrical equipment is grounded. Three-pronged plug and rounded outlet to decrease the risk of electrical shock. Ensuring that outlet covers are used in environments with individuals at risk for sticking items into them. Unplugging equipment using the plug. Not the cord. To prevent bending the plug prongs, which increases the risk for electrical shock. Ensuring that life support equipment is plugged into outlets designated to be powered by a backup generator during power outages. Disconnecting all electrical equipment prior to cleaning. Ensuring that all pumps, general and PCA, have free flow protection to prevent an overdose of fluids or medications. Ensuring that outlets are not overcrowded and that extension cords are used only when absolutely necessary. If they must be used in an open area, tape the cords to the floor. Using all equipment only as it is intended. Equipment should be regularly inspected by the user prior to use. Fatty equipment, frayed cords, disrepair can start a fire or cause an electrical shock and should be removed from use and reported immediately per agency policy. Facility protocols, reporting incidents, incident reports. When completing an incident report, include patient's name and hospital number, or visitor's name and address if visitor injury, along with the date, time, and location of the incident, factual description of the incident and injuries incurred, avoiding assumptions as to the incident's cause, names of witnesses to the incident and patient or witness comments regarding the incident, corrective actions that were taken, including notification of the provider and referrals, name and dose of any medication or an identification number of any equipment involved in the incident. Managing patient care, conflict resolution, grievances. Typical steps of the grievance process started at the first level of management and continued up the chain of command as needed. Formal hearing if the issue is not resolved at a lower level, professional mediation if a solution is not reached during a formal hearing. Bipolar disorders, complications, physical exhaustion, and possible death. A patient in a true manic state usually will not stop moving and does not eat, drink, or sleep. This can become a medical emergency. Nursing actions, prevent patient self-harm, decrease patient's physical activity, ensure adequate fluid and food intake, promote an adequate amount of sleep each night, assist the patient with self-care needs, manage medication appropriately. Legal responsibilities, advance directives, types of advance directives, durable power of attorney for healthcare. A durable power of attorney for healthcare is a documentation in which patients designate a healthcare proxy to make healthcare decisions for them if they are unable to do so. The proxy can be any competent adult the patient chooses. Professional responsibilities, advance directives. Durable power of attorney for healthcare. A durable power of attorney for healthcare or healthcare proxy is a legal document that designates a healthcare surrogate, who is an individual authorized to make healthcare decisions for a patient who is unable. The person who serves in the role of healthcare surrogate to make decisions for the patient should be very familiar with the patient's wishes. Living wills can be difficult to interpret, especially if the face of unexpected circumstances. A durable power of attorney for healthcare as an adjunct to a living will can be a more effective way of ensuring that the patient's decisions about healthcare are honored. Managing patient care, critical thinking. Clinical judgment. Clinical judgment is the decision made regarding a course of action based on a critical analysis of data. Clinical judgment considers the patient's needs when deciding to take an action or modify an intervention based on the patient's response. The nurse clinical judgment to analyze data and related evidence, ascertain the meaning of the data and evidence, apply knowledge to a clinical situation, determine patient outcomes desired and or achieved as indicated by evidence-based practices. Prioritization and time management. Nurses must continuously set and reset priorities in order to meet the needs of multiple patients and to maintain patient safety. Priority setting requires that decisions be made regarding the order in which patients are seen. Assessments are completed, interventions are provided, steps in the patient procedure are completed, components of patient care are completed. Establishing priorities in nursing practice requires that the nurse make these decisions based on evidence obtained during shift reports and other communications with members of the healthcare team through careful review of documents by continuously and accurately collecting patient data. Managing patient care, quality improvement. Steps in the quality improvement process. A standard is developed and approved by a facility committee. Standards are made available to employees by way of policies and procedures. Quality issues are identified by the staff, management or risk management department. An interpersonal professional team is developed to review the issue. The current state of structure and process related to the issue analyzed. Data collection methods are determined. Quantitative methods are primarily used in the data collection process, although the patient interview is also an option. Data is collected, analyzed, and compared with the established benchmark. If the patient is not possible Possible influencing factors are determined. A root cause analysis can be done to critically assess all factors that influence the issue. A root cause analysis focuses on the variables that surround the consequence of an action or occurrence. It is commonly done for sentinel events, patient death, patient care resulting in serious physical injury. Patient can also be done, but can also be done as part of the quality improvement process. Investigates the consequence and possible causes, analyzes the possible causes and relationships that can exist, determines additional influences at each level of relationships, determines the root cause or causes, potential solutions or corrective actions are analyzed, and one is selected for implementation and educational or corrective action is implemented. The issue is reevaluated at pre-established time to determine the efficiency of the solution or corrective action.